I have just mentioned that parents should have age appropriate expectations for children's self care skill development. Do you know what children can do at different ages? In fact, children aged 2 to 3 years can often eat with a spoon and get food with a fork. For 3 to 4-year-old children, they are generally able to use chopsticks to push the food into their mouth and use knife to cut soft food. At about age 4 to 5, children usually know how to use chopsticks to grab food. Apart from using cutlery, there are several other skills associated with eating. Children aged 2 to 3 years are often able to drink with a cup independently. At age 3 to 4, children are able to handle carton drinks without spilling out. When children reach age 4 to 5, they can usually pour drinks out from a small bottle without spilling out and remove food packaging. Let's move on to talk about children's toileting skill development. Let me explain to you in detail now about children's toileting skill development. At the age of 2 to 3, children are able to express the need to toilet. For 3 to 4 years old, children know that they need to flush the toilet after use, and they can identify the signage of boys and girls' toilets. Reaching 4 to 5 years, children can sit still on the adult toilet and tear the required amount of toilet paper. When they are 5 to 6 years old, they can tear the required amount of toilet paper, fold it up, and use it to clean up after pooping. Next, children aged 2 to 3 years often know how to use a toothbrush to brush their teeth roughly. When children are 4 to 5 years old, they generally know how to use towels to wipe their faces. At ages 5 to 6 years, most children can bathe on their own and use a comb to comb their hair tidily by themselves. Next, in terms of clothing, in fact, 2 to 3-year-old children only know how to pull off socks. When children reach ages 3 to 4 years, they start to know how to wear shoes. However, only when children reach ages 4 to 5 years, they can differentiate between left and right shoes and wear socks correctly. There are differences between the difficulty levels of wearing and taking off clothes. Taking off clothes is always easier for children. 2 to 3-year-old children typically can take off trousers, jackets, or shirts by themselves. When they reach 3 to 4 years old, they are generally able to wear trousers, jackets, or shirts by themselves. They also know how to wear and take off t-shirts when they reach 4 to 5 years old. Moreover, for fasteners, children at ages 2 to 3 years are able to buckle Velcro, unfasten and fasten large buttons at ages 3 to 4, and use open-end zippers at age 4 to 5. Finally, let's move to the self-care skills related to daily living. When children are at age 2 to 3, they can put their own toys in a fixed place and put a folded towel in the box. At ages 3 to 4, children can wrench open a door and use the buttons in a lift. 4 to 5-year-old children can hang a jacket on a hanger and use the escalator. When children reach ages 5 to 6 years, they are often able to clean up dishes after meals and gather dirty bowls and dishes separately and follow traffic rules. Here, I would like to remind parents that although the basic sequence of self-care skill development is similar across children, there are individual differences in the pace of achieving different self-care skills. For example, children generally know how to use spoons before they learn to use chopsticks to grab food. Some children, however, may do it at an earlier age than other children do. Besides, it should be noted that self-care skill development is closely related to other aspects of development, such as gross and fine motor skill development, body coordination, and cognitive development. For example, when children pour water from a bottle into a glass, gross and fine motor skills are required to lift up and hold the bottle, whereas hand-eye coordination is required to pour water accurately into the glass. When children wear shoes, they need to have the cognitive skill of distinguishing left and right shoes. Moreover, gross motor skills and eye-foot coordination are required to put the feet into the shoes. Fine motor skills and eye-hand coordination are required to tie the shoelaces. If children show serious delays in mastering self-care skills expected for their ages, parents need to keep an eye on children's developmental progress and seek advice from experts.